it's moderate or severe, can become the worst health crisis and maybe psychological crisis someone's ever gone through.
It's one of those things where there's a lot of real regret when you realize that you've done something that has damaged yourself.
Individuals with COVID experienced changes to their auditory system.
My life is permanently altered. I don't know if it's ever going to be okay again.
It does trigger the psychological system. It triggers the nervous system.
I think it can kind of freak people out, particularly if there is a rapid onset of...
Just due to an interest with working in healthcare and liking sound and music. And then I chose tinnitus because it was focused on the whole person and the psychology of the person, and it was not so device focused as some of the other niches. So yeah, that was how I got into tinnitus specifically.
So when I was younger, I played a lot of music and I was a drummer, and I was around a lot of really loud music. And
yeah.
When you're young, you really want to hear that music. You want to hear it rolling through your veins. And so you tend to sometimes take the earplugs out. And I have some residual hearing loss from that. When I'm in a restaurant, it's hard for me to I have to really focus in on people's voices and so forth. But it's one of those things where there's a lot of real regret when you realize that you've done something that has damaged yourself. And there's a little bit of grief over that. There's a feeling of real loss that you have when your hearing doesn't work exactly the way that it's supposed to. It is very much like losing a hand. And so, when you're treating people who are having a sudden onset of hearing loss, tinnitus, this sort of thing, what are you seeing with them psychologically?
Certain populations of people are more affected by tinnitus or tinnitus ear ringing than others. And we learn quickly that it's much more than just an ear condition, that it does trigger the psychological system. It triggers the nervous system. Tinnitus, when it's mild, is very manageable, but tinnitus, when it's moderate or severe, can become the worst health crisis and maybe psychological crisis someone's ever gone through. And it's important to note that tinnitus is not a psychological or psychiatric disorder, that it can create anxiety, it can create stress, it can create insomnia, which might mirror psychological conditions.
Yeah, it has that ability because there's, like I said, some grief that's attached to it, and some level of feeling like, oh my gosh, like my life is permanently altered. I don't know if it's ever going to be okay again. And so when you've been dealing with people and you're seeing them become more and more almost traumatized by the change, driven a little bit kind of, I don't know, feeling crazy because of this, what are the kinds of things that you see people go through?
Stages of grief, from, oh, this will go away quickly, to there must be some quick fix to this, to, oh my God, I can't believe I had this, to projecting into the future. I don't know what my life is going to be like. I can't handle this. And then finding the guide, for like the hero's journey. I think of the hero's journey a lot, and finding that guide or that resource or that doctor or the like who can get us from I'm suffering to I'm actually okay and I can live my normal life.
You designed Treble Health to be a certain thing. And I know that there's a lot of the kind of audiology world through the last several decades that has just simply worked with, can you hear this? Can you hear this? Can you hear this? And trying to go just through improving the hearing. You have much more of a holistic route on dealing with people who are having these kinds of hearing loss. Can you talk about the different technology that helps you with the whole person?
Tinnitus is something that's more than just the ear, so it affects sleep, it creates anxiety, it can create stress. It can activate the fight or flight system in the nervous system. So what I look for is, what are the evidence-based strategies for reducing tinnitus? There are the ear-specific strategies like hearing aids or sound therapy. But then there's also some other equally, if not more effective strategies that get us out of the fight or flight response psychologically, that get us grounded in our nervous system and settling our nervous system a bit. Because tinnitus is something that the brain can naturally heal, the brain can naturally improve with the right system in place. So I think sound and settling the nervous system, like those are actually natural treatments in some way. They're not invasive. It's not medication. It's not surgery, but it does have to be set up in the right way. So it's a whole person perspective for someone with tinnitus. Absolutely, Jeremy.
Yeah, and it's something that I think it can kind of freak people out, particularly if there is a rapid onset of this. Which what would create a rapid onset of this? I didn't really ask that question yet.
Stress can create a rapid onset of tinnitus, and psychological stress, financial stress, going through another health crisis or another health problem where the brain is subconsciously putting more attention on symptoms and health. Any of those types of things can ramp up tinnitus. Then there's more of a medical cause, which is sudden changes to your hearing, which can happen from various reasons, from viruses, infections, uh, loud noise events, medication changes, things like that.
There's a COVID aspect to this. Are you seeing people with rapid hearing loss or the tinnitus that is COVID related?
There was a study that found that less than 10% of individuals with COVID experienced changes to their auditory system. And the data there just supported that, hey, a significant percentage of people did report tinnitus after getting the COVID infection. And then it's harder to track what did the vaccine do. But you add on to that just the amount of stress and mental health challenges that we went through during the pandemic, that uh, all these factors combined, there was definitely an increase in tinnitus prevalence, bothersome tinnitus prevalence amongst the population, yeah, between 2020 and 2022. Yeah.
Yeah, I see a lot of that sort of thing in my own mental health practice with people, is that the stress level of the last 4 to 5 years has been astronomical in people's of all ages, of all demographics, and the stress is financial. The stress is obviously there's our political system is in a bit of an upheaval right now. There's stress between people. There's new health problems and difficulty being able to access care for those sorts of things, and I would imagine that all of these things can be a factor in this. I've seen ringing in the ears. I've seen more in terms of panic attack symptoms, more in terms of just kind of an overall malaise in people's behavior, anxiety, depression, all of these sorts of things. And, what I love about Treble Health is that you've taken such a holistic approach that you really do look at the whole person, and you recognize that the individual who has the ringing in the ears, the rapid onset change in hearing, you can do as much as you can to help the person physically deal with the change in how their body is, but you recognize that there's this other part of coping, of acceptance, of changing the way that you think, and so that you're not just simply focused on what you've lost, you're focused on what you can do. And there's such a positive aspect of that. And I love what you've put together in this. And your YouTube channel is absolutely outrageously good with so much wonderful information. The Treble Health YouTube channel is just an absolute wealth of information for people who are dealing with hearing changes. And here you have all of your physicians on there doing podcast episodes about what they've been seeing in the practice and everything like that. This must have taken you quite a long time to build this way.
It was my passion really to create information about this for people with tinnitus. And at the beginning, my intention was, I know that I wanted to work and specialize more with tinnitus patients. I was living in the Bay Area, so I saw an avenue to do that with technology. And there was some other people, one in Australia, one in England, who were making some traction on YouTube. And I thought, hey, I'm just as smart as them. I think I know a lot about this, based on residency program in San Francisco, being at a hospital. And there was 2 years of consideration. And then I said, I went on this long hike on the Pacific Crest Trail with my friend. And I always come out of those hikes with clarity, just like, things are simple and clear. And one of my takeaways was, okay, I want to start the YouTube channel. A few months later, the pandemic happened and I was ready to go. So while other people might have started considering what should they do at that point, I actually had all the camera equipment. I was ready mentally. I was ready to go. And then, yeah, that was 6 years ago. And there's a lot of people in the world with tinnitus, Jeremy. So, we're just getting started here. Most people still do not know Treble Health, who struggle with tinnitus, which is fine. But our mission is to just make sure people get better resources and possibly treatment as well.
Tell everybody where to get a hold of you.
Yeah, so for those listening, you guys can reach out to my team at treblehealth.com. Or if you have tinnitus and you want to assess how bad is it or what should you do about it, there is a free online assessment we created called tinnitusquiz.com. That's available for you guys as well. So again, that's Treble Health, or you can check out the quiz at tinnitusquiz.com. Thanks so much.
Please don't forget to like and subscribe to the Mindful Mutiny podcast. And remember that in a lifetime, there are more decisions than anybody can count. Living the highest version of yourself is the most rewarding thing that you can do. Make incredible, positive, risky, and bold decisions to be the highest version of you. Now go be something great.